Here to look ahead to today's vote and the high-stakes politics surrounding it, House Democratic Caucus Chairman John Larson of Connecticut and the House Republican Conference Chairman Mike Pence of Indiana. Gentlemen, thank you both for joining me.
Happy to be with you.
Thank you, Kenny.
State of play. Where are you? 216? Have you got them locked in?
This is a historic day, and we are happy warriors. We are so proud of the Democratic Caucus that we will be a part of history, joining Franklin Delano Roosevelt's passage of Social Security, Lyndon Johnson's passage of Medicare, and now Barack Obama's passage of health care reform.
So you've got the 216.
We've got the votes, and the reason for that, Candy, I think it started earlier this week with Natoma Canfield becoming the poster child for, or lady, for health care reform. And that struck such a chord within our caucus. And Dennis Moore standing up to give a speech in the caucus was blackberried by a woman who works for him in Kansas. She said, "Thank you for voting for this. I know I'm losing my job at the end of this year, and unfortunately I've just been diagnosed with cancer. Without this bill, I'm lost." Dennis ended by saying, "And she's 24. You could have heard a pin drop. This is about whose side you're on. And clearly, this historic moment in the People's Chamber, we're on the side of the American people and those that have been denied access to health care, and those who have pre-existing conditions who have been denied, and those who have had their policies rescinded."
Congressman Pence, I think that puts you on the side not of the people, if we take his calculation. What is left for Republicans to do? Congressman Larson says they have the 216. So it's all over but the shouting? You guys vote no and move on?
Well, I don't know if they have the votes. House Republicans are going to use every means at our disposal.
What is that?
Well, stay tuned, Candy. It's going to be an interesting day.
I mean, can you disrupt the vote? Or what, I mean, what's available?
We're going to use every means at our disposal to oppose this government takeover of health care. Because, quite frankly, you know, as you know, thousands gathered at rallies all across this country and here in the nation's capital yesterday, you know, the American people are sick and tired of runaway federal spending by both parties, of borrowing and bailouts and takeovers. And I believe this is going to be a historic weekend.
It is.
But I think it's going to be different in the way that John thinks it's going to be. I think this is going to be a historic weekend because I think this weekend is going to be the beginning of the end of business as usual in Washington, D.C. I think the American people see an administration and see a Congress that are in a headlong rush to confront the very real challenges that we have in health care with more government instead of more freedom. They know the Republicans have been offering solutions from the beginning. Let people purchase health insurance across state lines, pass malpractice reform, cover pre-existing conditions. All of that can be done without a massive $1 trillion expansion of the federal government and burdening future generations with more deficits and more debt.
But the reality of this day is that you don't have the votes to stop it. You may have the means to delay it.
Right. You know, the Republicans, it shouldn't be a news flash to anybody. Republicans don't have the votes to stop anything in the House of Representatives. We're in a decisive minority.
Talking politically.
But what's remarkable about this one-year debate has proven my point that a minority in Congress plus the American people equals a majority. The reason that they weren't able to do this last year, remember all the deadlines? We had deadlines in the summer, we had deadlines in the fall, we had deadlines at the end of the year. The American people don't want this government takeover of health care. And I do believe, I don't know if they have the votes today, but I guarantee you the American people know they have the votes in November.
The American people who are already on Medicare, all of our veterans who already receive TRICARE, understand the importance and the value of having insurance coverage. For 47 million Americans who have none, 31 million will now be able to have access to insurance, lowering costs for small businesses, lowering the national debt. First $138 billion and then $1.2 trillion. We can't afford not to do this. And then taking care of those people.
I want to talk about the debt. Hang on one second, because I've got to take a quick break. We'll come back, because I do want to talk about the cost, because there are some figures out there floating. I'll do that. We will be back with Congressman Larson and Pence right after this.